Welcome back to Smile Wide.
Ever wondered why dental health is so crucial to your overall well-being? Well, let me tell you, it's not just about flashing a pearly white smile, it's about maintaining a balance in your body's health. Poor dental hygiene can lead to a host of issues, from bad breath and cavities to more serious conditions like heart disease. Yes, you heard that right. The bacteria from inflammation of the gums can enter your bloodstream and travel to your heart, leading to heart disease. Among the myriad of dental problems we encounter, tooth decay is one of the most prevalent. And when that decay becomes severe, it doesn't just cause a toothache, it can lead to infections, abscesses, and even loss of the tooth. One of the most common treatments for severe tooth decay is the root canal procedure. But what exactly is it? The term root canal might sound intimidating, but it's a fairly straightforward procedure. A root canal is a treatment used to repair and save a tooth that is severely decayed or infected. Now you might ask, why is it necessary? Well, inside our teeth, beneath the white enamel and a hard layer called dentin, is a soft tissue known as pulp. This pulp contains blood vessels, nerves, and connective tissue, which help grow the root of your tooth during its development. However, when this pulp becomes inflamed or infected due to deep decay, repeated dental procedures, faulty crowns, or a crack or chip in the tooth, it can cause pain or lead to an abscess. That's when a root canal becomes necessary. A root canal removes the inflamed or infected pulp, carefully cleans and shapes the inside of the tooth, then fills and seals the space. This process helps preserve the tooth and prevent further damage. Think of it like a hard reset for your tooth, bringing it back from the brink and restoring its health. Severe tooth decay is one of the primary causes that lead to the need for a root canal. It starts with a simple cavity, but if left untreated, the decay can reach down into the tooth's pulp, creating a pathway for bacteria to enter and cause an infection. These bacteria can multiply within the pulp chamber, causing pressure, inflammation, and pain. Another cause is dental trauma, such as a chip or crack in the tooth that exposes the pulp, allowing bacteria to seep in. Repeated dental procedures on the same tooth can also lead to this procedure, as they may cause undue stress to the pulp. While the term root canal might conjure up images of pain and discomfort, the reality is that the procedure itself is no more painful than having a filling placed. In fact, it's designed to relieve pain, not cause it. Understanding the procedure can help alleviate anxieties. So what happens during a root canal? Let's deconstruct the root canal procedure step by step. Picture this as a journey, a voyage to the center of your tooth. It all starts with the initial examination and X-ray. Your dentist will check your tooth and take an X-ray to get a detailed look at the shape of your root canals and check for any signs of infection in the surrounding bone. This is like the reconnaissance stage of our journey, getting the lay of the land before we forge ahead. Next, we move on to the local anesthesia. Don't worry, this isn't as scary as it sounds. Your dentist will numb the area around your tooth to ensure you're comfortable and pain-free throughout the procedure. Think of this as the safety precautions before we embark on our expedition. Once everything is numb, it's time for the pulp removal. The dentist will make an opening in the top of your tooth and carefully take out the diseased pulp. This is like clearing the path for our journey, removing any hurdles or obstacles in our way. Next comes the cleaning and shaping stage. The dentist will clean the inside of your tooth and shape the root canals to prepare them for the filling. This is akin to smoothing out the road, making sure it's all ready for the final stages of our journey. The filling and sealing stage is next. The dentist will fill your root canals with a rubber-like material and seal the opening with a temporary filling. This is like paving the road, making sure it's secure and ready for traffic. Finally, we arrive at the last stage of our journey, the final restoration with a crown. Your dentist will place a crown or other restoration on your tooth to protect it and restore it to full function. This is like the grand opening of our newly paved road, all shiny and new and ready for use. And there you have it. That's the root canal procedure in a nutshell. But what about after the treatment? Taking care of your teeth post-procedure is just as important as the treatment itself. After your root canal treatment, you'll want to ensure that your tooth and surrounding gums heal properly. This means following your dentist's instructions closely. Pain management is often a concern for patients post-procedure. Over-the-counter pain relievers can generally help with any discomfort. It's also crucial to avoid chewing or biting down on the treated tooth until it has fully healed. Maintaining oral hygiene is another key aspect of aftercare. Brushing twice a day, flossing daily, and using antiseptic mouthwash can help keep your mouth clean and prevent infection. Regular dental checkups are also important to monitor the healing process and to ensure that no further issues arise. Let's also talk about prevention. Although root canals are sometimes unavoidable, there are steps you can take to reduce your chances of needing one in the future. Regular dental cleanings and checkups can catch potential issues early. A diet low in sugar can also help to prevent tooth decay, one of the main causes of root canals. And of course, a good oral hygiene routine, including brushing and flossing, is your first line of defense against most dental problems. Ultimately, the health of your teeth and gums is in your hands. Caring for your mouth post-procedure and practicing preventive measures can go a long way in maintaining your dental health. Remember, good dental health begins with good habits. Want to know more about dental health and treatments? If this video piqued your interest, we invite you to delve deeper. Our blog has a wealth of information not just on root canal treatments, but also on a plethora of other dental health topics. It's all there, waiting for you to explore, learn, and empower yourself with knowledge. So what are you waiting for? Visit smile-y.co.in now, and keep that smile healthy and bright.
For more dental tips, log on to smilewide.co.in.